Hi, I'm Andrew Einstein, a cardiologist at Columbia University Medical Center in New York, and it's my pleasure to welcome you to Molecular Imaging Highlights from the American Heart Association Scientific Sessions in Orlando, Florida. The American Heart Association Scientific Sessions is one of the world's leading cardiovascular meetings. There are about 25,000 people here to share the latest news and advancements in cardiovascular medicine. And we're talking about some of the latest advances in cardiology medicine, and in particular, focusing on molecular imaging and molecular medicine. Rob Beanlands, thank you so much for joining us today.
Thank you, Andrew, for having me.
You're very welcome. Can you tell us what molecular imaging is?
So molecular imaging is the evaluation of molecular function at the cellular level using imaging to make those measurements. So in our case, we're interested in the heart's cellular function and the vessel wall cellular function. So how molecules behave in the cells of the myocardium and the cells of the vessel wall.
And what is inflammation?
So inflammation is an active process that is stimulating inflammatory cells such as macrophages, white blood cells, and so on, that can, at least initially, may be a protective process, but then in tissues like the vessel wall and the myocardium can potentially be destructive. And in the case of atherosclerosis, we now know that inflammation is an active part of that process. And with imaging, we can actually image parts of that function. The reason we can do that is because at the simple level with tracers such as fluorodeoxyglucose, we can look at the metabolic activity of the macrophages in the inflammatory plaque, because the macrophages are very, very active metabolically. So they take up glucose and therefore they take up FDG quite avidly. So there's lots of good research that the uptake of FDG does correlate with activity. The problem with FDG is that it's fairly ubiquitous in its uptake and is not so specific to the different processes. So people are looking at other molecules along the pathway of inflammation to determine whether or not we can actually image that. One of the other processes that people are interested in is the process of calcification, which we now know is an active process in the progression of plaque, and it might actually be occurring very early in plaque inflammation and progression. So we now have a tracer, sodium fluoride, which can actually image the calcification of the plaque as well. And the belief is that these tracers may allow us to define when a plaque is most inflamed and potentially most vulnerable for plaque rupture, which would lead to adverse events such as heart attack and stroke. So the idea is to be able to identify those patients earlier in a more personalized manner for individual patients to predict which patient might be susceptible to those cardiovascular events.
What's the relationship between ultrasound and these molecular imaging techniques?
Ultrasound is generally considered a structural methodology. It can give you measurements of the volume of plaque and the shape of the plaque and so on. It can also look at various characteristics of the texture and the surface. And there's some, we didn't present this at this meeting, but we are working on this to know whether the texture and the roughness of the plaque, if you will, is another factor in predicting the adverse outcome. We do believe, and we did show, that there is a relationship between the volume and the remodeling of the plaque and the inflammatory processes that are defined by molecular imaging with tracers such as FDG. This was the presentation that we had here at the American Heart Association meeting. So there is a relationship there, and so there is a potential that this could be used to predict either plaque progression and or the vulnerability of the plaque, the likelihood, or the vulnerability of the patient, the likelihood that they may actually develop adverse cardiovascular events.
Now, what is the Canadian Atherosclerosis Imaging Network?
So the Canadian Atherosclerosis Imaging Network is a network of centers in Canada, and its goal is to use and apply imaging to better, on the one hand, understand disease, to understand where imaging could be used to evaluate progression of disease and to look at whether we can better understand the biology of the plaque and the disease process of atherosclerosis.
And what were the novel findings presented by this imaging network here at the American Heart Association scientific sessions?
So the work that was presented here builds on some earlier work. I'll give a capsule of that we've been able to show, as have others, that FDG as a molecular imaging target or agent, if you will, to look at the inflammation of the plaque, it does relate to the plaque biology. So we've been able to show that. So on that basis, we've also done multiple imaging tests on this group of 100 patients, and we presented a portion of those patients and their relationship to ultrasound at this meeting. And we're able to show that the volume of the plaque measured on ultrasound, on three-dimensional ultrasound, not conventional two-dimensional ultrasound, but three-dimensional ultrasound, correlated well with the amount of inflammation that was going on. So as the inflammation expands, so does the plaque volume. And the hope is that with the longer-term follow-up of these patients, we're going to be able to use that information to tell whether we can predict which patients are vulnerable to heart attacks or strokes.
Is one of these imaging techniques better than the other, or do they answer different questions about the process of atherosclerosis?
It's not clear whether one is better than the other in terms of predicting events. We do believe, however, that they're most likely complementary, providing structure information and function. And I think we're now more and more than ever appreciating that both pieces of information are important. So the structure or anatomical characterization with techniques such as ultrasound, CT, and the inflammation or molecular processes provided by techniques such as PET imaging and SPECT imaging.
What's the long-term goal of your research program in the Canadian Atherosclerosis Imaging Network?
So it's to optimize the techniques and to develop the best techniques for predicting which patients are at risk for cardiovascular events and apply imaging for that purpose.
Sounds very important. We've spoken with some of the other speakers today about the role of imaging in prevention, and it sounds like the techniques which you're developing and validating here will play an important role in predicting which patients have heart attacks, have strokes. So I commend you and your colleagues for these important contributions. So thank you very much for joining us today.
Thanks very much. We're very excited that we're breaking new ground, and I think it's a very exciting field of development for the future.